Do you ever get the feeling that you always have tired eyes or having to rub them constantly because they feel tired or dry? You just look tired overall. Having the lid so heavy that you can't even keep your eyes open. Well, what if I told you that it could be something more? My name is Lisa Marquez, and I will be presenting blepharotosis. I've done a lot of research on world-renowned surgeons on blepharotosis. And the importance of it is severe because it can lead to vision loss. So I'm going to help you identify these things by providing an overview of ptosis, cases, as well as treatment for ptosis. Then I will recap all of this and answer any questions that you may have. So first, what is ptosis? Lipsky defines ptosis as when the upper eyelid droops over the eye. It can affect one or both eyelids. It can occur later on in life, or it can be present at birth. Ptosis symptoms he discusses are dry eye, look of tiredness, having to tilt your head in order to see better, or even having to raise your eyebrows up so you can get a better field of vision. So let's talk about the second topic, which is going to be cases. I'm going to be presenting two different types of ptosis. And first is going to be congenital ptosis. Leal shows us here a patient whose vision is being obstructed by the lid, which is drooping over the eye almost completely. There's not even a crease on his eyelid, and we can see that the patient is tilting the head in order to be able to see better. Here we have a post-op photo of the patient. Now this congenital ptosis can be diagnosed within the first year of life, as Leal states. The second type of case I'm going to be discussing is involutional ptosis. Now, Lipsky describes this as age-related, so ptosis in adults. Here you can see that the patient's vision is obstructed on one eye more than the other. Now, the reason Lipsky says this happens is because the muscle will stretch out within time and sometimes even detach completely from the eyelid. So let's move over to treatment then. What can treat ptosis? Number one would be Botox treatment, and this would be strictly for mild case ptosis. So Mustak describes this as less than 1 millimeter droop. On the far left, you'll be able to see all of the mild cases here, and some not even noticeable to you and I, but they can feel the heaviness of the eyelid, or they just seek for asymmetry. In the middle, you'll see the injection patterns for Botox, and on the far right, you'll notice the improvement that this treatment has caused for the patients. Now, this would be considered cosmetic, and you would need to maintain this 3 to 4 months in order to better the droop. Another type of treatment would be surgery. Stein talks about blepharoplasty. Now, this is an eyelid surgery, and it changes the skin, fat, and muscle, so it can improve the vision. The incision is made here, right at the crease of the eyelid, so it can hide it better. So allow me to wrap this up. We have provided blepharoptosis information, giving you an overview of ptosis, cases, and treatments. Now we can identify what ptosis is, which is that droopy eyelid because of a faulty levator muscle. Secondly, we can now identify two different types of ptosis cases, ptosis in a child versus ptosis in an adult. And lastly, we can talk about treatment, one being Botox and the other being surgery. Now remember, Botox for mild cases of ptosis and surgery for moderate to severe cases of ptosis. So you see, it can be more than just tired eyes. It can be ptosis. But now you're able to identify it, keep calm, and just go see a doctor. Thank you so much for joining me, and here are my references.